with blood pressure, and we'll talk about Michael Jonas is going to talk about radial approach for renal denervation with the 4F TIVO system.
So thank you for the opportunity to present this radial approach, first in human renal denervation technology with a TIVO system. So evolution makes better from good, and renal denervation has significantly evolved since the surgical sympathectomy in the 1950s. RDN, as a startup company, used an off-the-shelf technology for RF. This was significantly evolved by Medtronic after its acquisition to the simplicity and to the spiral catheter. Further evolution to ultrasound allows for a deeper penetration and possibly better results as shown by the ReCore technology. Sonivi, with a TIVO catheter, as you have just heard, is a next evolutionary process for the ultrasound technology by applying a catheter that has 3 simultaneous ultrasound deep penetrating elements and by eliminating the occlusive balloon, making for a very fast and simple procedure. And the next evolutionary process is to take it from the femoral approach to the radial approach. We know this is significantly better for the patient. It allows for same-day discharge, has significantly less complications. And now I introduced the TIVO's 4 French radial device. So we see here the 6 French device, and this is a 4 French device. It's a rapid exchange 0.14 wire, 130 centimeters long. The patients included are part of a sub-study, an amendment to the reduced 1 pilot study, which you have just seen. And our first patient is a 57-year-old male, a typical renal denervation candidate who was enrolled in the reduced 1 pilot study, on med, uncontrolled. His CT scan shows a normal right renal artery, and on the left you see a very early bifurcation with 2 renals, which are practically 2 accessory arteries. So this patient underwent the first radial approach renal denervation procedure with a 4 French device, left radial, standard multipurpose guiding catheter, 0.14 BMW workhorse wire. You see cannulation of the right renal artery. Again, it's a significant improvement from the radial approach. Makes it easier to cannulate these downward pointing renal arteries. Tracking of the 4 French device, it's very simple, and accessing the right renal artery. Having the device deep into the distal right renal artery, parking it in the distal element, and starting to denervate, pulling back from distal to proximal, and denervating along the pullback. And when we're done with the right renal artery, we just flip the catheter to the left side using the same wire. It's the same catheter, the same guiding, just to go over to the left renal. As you see here, when we saw this patient has really early takeoff, it's really like 2 accessory renal arteries. So we access first the lower segment, the lower renal artery, and then again the same wire, the same catheter goes to the upper segment, and denervating from distal to proximal. So in total, 21 excitations, 11 on the right renal and 10 on the left renal, and this is our vision. It's 1 wire, 1 catheter, significantly less than 1 hour in the cath lab, and less than 1 day with this radial approach. The patient is discharged same day. So to conclude, the TIVO's 4 French RX ultrasound catheter is designed for renal denervation via 6 French radial approach. The first 2 cases have been performed successfully in Israel, and the effectiveness and safety of the device will be assessed as an extension of the reduced 1 pilot study. Thank you.
Questions and from the panel. Yeah. 1 question. Please, go ahead.
Why don't you go to the mic, because it's recorded? Otherwise, people cannot hear it on demand. Is the ultrasound denervation painless?
The ultrasound denervation is painless when the patient is sedated.
Okay. So it's not a big difference. No, because you can make the coronary angio by radial, and then at the end you just fix the renals.
Yeah, but then you get paid only once. But putting that aside, the patient, it is painful. But what we find is because it's a very short procedure as compared to other denervation technologies, so you just sedate the patient and you give them a mild sedation, but it is painful. For excitation, it is painful.
I guess for the FDA, you most likely was going to go with the 4 French device.
Yes, the FDA is also painful, but we have ongoing discussions with the FDA, and we'll beat them too.
Yeah.
We'll beat them too.
So.
Okay, thank you.
I tell you.